Hello everyone, this is Bob Browner, recording update number 3. The others worked pretty well and are at 10,000 views, so I thought I'd throw this out there for what's happening in our community and what could happen in yours as well. This morning I update some of our education leaders on what I could see going on with the coronavirus right now, and as many of you know, it's been more infectious than we thought. We're seeing differences all across the world, and now the cases outside of China have exceeded those cases in China. For me, the most important thing is that history does not repeat itself. So this is a good slide from the 1918 flu cases of the tale of two cities, one that did it right and one that got on top of things really quickly. Philadelphia, of course, that this is a different day and age. They maybe can't be blamed, but they did wait too long. From the first day of their case to the time they actually made a decision was over 2 weeks. The rest is history, and tens of thousands of Philadelphians died. On the other hand, St. Louis, after their first case, and from then to making a decision, only took 2 days, and they were able to get some of the social distancing and other things involved, and far fewer people died. We're now at a point internationally that we know which countries are which, and we have our own versions. So if you look at the national data here, you can see that the case fatality rates are all over the map. Well, there's two reasons for that. One is that some of the cases, some countries are slow to get their cases identified, so it makes the mortality rate look low just because they don't have as many identified. You know who's dead because that's pretty black and white, but you don't know who's identified. So some of these numbers in this 3, 5, 7% are somewhat over exaggerated, although still worse than they could be. You can see who's doing it well by looking at South Korea and Germany, for example. Their case fatality rates are low, one, because they are measuring lots of people, but they also have jumped on things and gotten things under control in a hurry. We need to do the same. So we kind of know right now who's Italy and who's Germany. I think we're at the inflection point of us finding out where here in the United States, across the country, which of us is going to be Philadelphia and which of us is going to be St. Louis. And it all depends on you guys all making the right decisions. So one of the things that we are not doing that we should have been doing was the testing. South Korea is now testing 15,000 people per day. I think that's more than been tested in the entire United States since the start. Until we can get to this point, it's going to be really hard for us to put things to a stop. And because of this, we don't know where we are in the epidemic. And so because of this, we had to be more cautious than them, not less cautious than them. So the problem is, where are we in this epidemic? Are we here or are we right here? The true answer, unfortunately, is that we do not know. We could already be here and not know it because of our lack of testing. And so because of that, we have to assume we're not here until we're proved we're not, until we prove that we're over here. And that's probably not going to happen. My best guess is it'll be 2 weeks till we get an adequate testing. And so until then, I do think we need to shut everything down. So again, a lot of us in the public health world have been sounding alarm for weeks now. We're stepping up. Some folks, I think, have stepped up at the risk of losing their jobs. We do not want history to repeat itself, and I think we do still have time to start making some things happen in the United States. And I'll be honest, when I saw these projections out of UNMC 2 weeks ago, I thought they were exaggerated myself until I got a copy of the slides and looked at the evidence brief and ran the numbers myself and realized, oh no, James Lawler at UNMC probably is correct. We better get on top of this. I reran our numbers on the Lincoln-Lancaster County level just to see what does it look like for our community. And so what he presented here, this is the assumption that we do everything right. Do we get on top of things, we slow things down, we hold the infection rates lower, we have adequate supplies to take care of people. And if this is the case, we're looking at 400 to 500 people dying in Lincoln, maybe 3,000 across the state. If we're in the middle range of that 1% case fatality rate, unfortunately it's higher. But if we respond too late like Italy, it's going to be much, much worse. Instead of 500 deaths, we might have 6,000 deaths. And the reason for this is that we'll run out of ventilators. We may not have enough people to ventilate all those folks. So you've probably seen this posted numerous times in your Facebook feeds. I hope whoever's posting this needs to keep it. The problem is if we slow things down right here, we have adequate medical care, and everybody who needs a ventilator gets a ventilator, and most of them will live. If our healthcare system gets overwhelmed because we waited too long to shut everything down, we'll have more sick people than we have ventilators, and every single one of these people will be dead. And so that's the difference between 500 deaths in Lincoln, Nebraska, and 5,000 deaths in Lincoln. Thankfully, Lincoln Public Schools did call off school, and we got lucky with spring break, and we extended another week. I suspect we'll be extending longer, just like everybody across the country, hopefully in the near future. I did see a report that 31 states now have already shut things down statewide. I suspect that will be at 50 by next week unless something dramatic changes. So what are you to do? The answer is basically these four simple rules. You'll hear NPIs, which stands for non-pharmaceutical interventions. Number one, if you're sick, stay home. Number two, if you're someone in your household is sick, stay home. What we need you to do is not go driving around the community spreading this to everybody. This is the social distancing, and this is what will help keep things at bay. Third thing is we have to close schools and large daycares. Home daycare is probably okay, but large daycares, yes. And the reason is that's a petri dish for everything to be spreading around. In Lincoln, Nebraska, a town of 300,000, there are 50,000 people in LPS every day. That's too much mixing, and that's why we have to close schools for the time being. And then social distance in the community and the workplace, because there are other places, concerts, basketball games, things like that. I was surprised at who our healthcare leaders in the country right now. Who would have thought the NBA and the NCAA would be some of our biggest public health leaders by closing things down when they did? So thankfully, we may be some of those people like that may be our surprising sources of leadership in addition to our universities and our schools. So here's what it looks like from a modeling perspective. And so essentially, I've had people say, well, closing the schools by themselves won't work. That's not exactly correct. Closing schools by themselves won't completely work, but it'll at least partially work. So essentially, if we have a 70% spread rate, we close schools, we could shut that down from 70% to 50%. That's better than nothing, but it's not all the way here. To get all the way here, we also have to close daycares and do the social distancing of our adults. This was a great article from Washington Post where you can literally run your own simulations on this, and I ran them myself. And so, they will now be a little different because they are subject to some random fluctuation, but it is really interesting to look at it. Essentially, what's the free-for-all do-nothing approach? This is overwhelming our health system and lots of people dying. If we do some partial measures like closing the schools, but we don't close daycares and we don't do this cancel the concerts and things, we could still have this. Not as bad as this, but still not good. If we moderate, but if we do it all, we could have a case like this, which was much, much, much better. So that's why your school districts are making some difficult decisions, as are your employers and public health departments. This is not an easy decision, obviously, but it's needed. We also know which countries did it right already, and so here we have Hong Kong and Singapore, who responded probably the quickest of anybody, and look at what happened to them. Japan, there's some question about the data. Are they sharing all of it? Although my daughter actually lives in Kyoto, and we Skyped with her yesterday, and she says yes, they are doing a pretty good job of shutting down. So I do think this is true. South Korea was the second country with the hit, and they did a good job, and they got it not faster than Chinese because they were prepared. They saw what was happening in China, they did the right thing, and look at what happened to them leveling off. Unfortunately, we have Italy, which was too slow to respond. Spain is following Italy right now. Where is the United States? Will we follow this trajectory and keep going up, or will we respond like the South Koreans and be like this? So again, flattening the curve. We need to close things down now because we don't know if we're here, and we're not going to know for at least a couple weeks until we're testing 15,000 people a day like South Korea, and that will probably be a few weeks. We need to be doing this. I think the drive-through testing is the best way because going to your doctor's office is actually going to spread things around worse. So don't go to the doctor's office unless you have to. Call them first. They may not have the testing supplies, or they may have already run out of gowns, and so this will be the safer way to do mass testing. So are we going to be Philadelphia or are we going to be St. Louis? I think time will tell, but I do think things are mobilizing now, and I think even across the country, people are shutting things down, and I think that could help us prevent us from being Italy and help us be more like Germany or South Korea or Hong Kong. So what's on the positive side? I think people are sometimes at their best when things are at their worst. I think on the last one I talked about my church council thinking, what could they do? And they actually thought, well, how can we help in the epidemic? Maybe we'll provide free childcare for healthcare workers. I also love, Facebook can be bad, but sometimes you see amazing things. This one from Tom Romaros, he's a physician here in town, entertaining his grandma by dancing in front of her. This is a great way to not be socially isolating. Social distance is not the same as social isolation, and it's important for our elderly because social isolation for our elderly could be almost as dangerous as coronavirus. And what a cool way to deal with that while still being safe. I've got some snarky friends and relatives who put things on like this. Your grandparents were called to war. You're being called to sit on your couch. You can do this. This person making a spoof on wildlife photography, seeing rare things in the wild like toilet paper. We can have our fun with this as well. And I think it's great to have people turning this into a little bit better than it could be. Also, again, being socialized, it does not mean staying inside your house. So there's things to do outside. You need to stay healthy too, and being out on the bike trails and around the lakes, walking your dog is perfectly fine. I saw my next door neighbors working in their yard, putting out mulch, getting ready for spring. So you do not have to just sit in your basement and hunker down. Other ideas that are coming up. I was working with one of our clinics last night, and they are struggling trying to figure out how they keep their workforce going because a lot of their nurses, receptionists, etc., need childcare. Well, you know what? Maybe we should put a community pool together. Maybe for people who are in essential occupations like healthcare workers, police and emergency medical personnel. Even low-income parents working paycheck to paycheck, desperate for childcare. We're going to have a lot of teenagers and college students home for a while. Maybe we could put together a community childcare poll for these people. So yes, it's trying times, but to take a lesson from others. Remember what you need to do. If you're sick, stay home. If someone in your household is sick, stay home. And please follow these directions and support your local folks who are making tough decisions to close the schools, even though people don't want them closed. And lastly, do something positive. And so I can't thank Tom Tammer enough for this post. It almost brought tears to my eyes. So there you are. Hopefully this is helpful. This is my day job. I work on a number of these things, so this is why I end up talking to these various folks. There's my one email. I've got the others, but that's probably good enough. And hopefully this is helpful to y'all.